This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And if you're able to do so, please use *6 to mute and unmute your phones. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-designee Andrea, and available to answer questions are Dr. Ryan Westergaard, Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel for the Governor's Office. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, folks. Thanks for joining us today. I hope everybody had a safe holiday weekend. As you likely know, the Department of Health Services and the Department of Public Instruction have been working diligently to make plans for our schools to safely reopen this fall. In light of that, today we have announced that the Wisconsin Emergency Management is working to ship more than 2 million cloth face masks and more than 4,200 infrared thermometers to K-12 schools across our state. These masks and thermometers will be distributed over the coming weeks to help our schools continue to prepare for kids coming back into the classroom and to supplement the other PPE that districts might be purchasing through other means. This is a great partnership as our schools and districts are taking the necessary steps to plan for ensuring the health and safety of our kids, educators, and staff this fall. So, over the past several weeks, we've seen an uptick in the number of COVID-19 positive cases, not only across our country, but especially right here in Wisconsin, where 6 of 7 regions in our state have seen high disease activity levels. As of this weekend, 46% of our total COVID-19 cases had tested positive within the last month. That means that while it previously took us about 5 months to reach 15,000 cases, in this last month alone, we have added more than 13,000 more. Folks, we cannot let this trend continue. From family get-togethers to weddings to financial hardship and mental and emotional challenges, Wisconsinites have sacrificed too much over the past few months for us to give up on our efforts now. We cannot go backwards. As of yesterday, nearly 796 Wisconsinites have died from this virus. Families across our state have lost moms and fathers and grandparents and kids and loved ones. Communities have lost leaders, familiar faces, and neighbors. And tens of thousands more Wisconsinites have been diagnosed, some fighting for their lives as we speak. Not worth it. No party, no bar is worth it. Among those who have tested positive, there's been an increase in folks who have met up with people outside of their immediate household in the 2 weeks prior to the infection. I know a lot of people have asked about issuing another safer at home order or requiring masks at the state level. Unfortunately, the reality is that the Supreme Court ruling in the Republican lawsuit really hamstrung our ability to respond to this pandemic. And that's why we continue to ask for your help. Public health is everyone's issue, and overcoming COVID-19 is on every community, on every age group, and every Wisconsinite. Staying home continues to be the best way to prevent getting and spreading this virus. We especially need our young people to step up, as we have seen a concerning increases in cases among Wisconsinites ages 20 to 29. Look, folks, nobody is immune from this virus. We have seen patients of all ages lose the battle against this virus, and we've seen how one positive case can lead to a dozen positive cases in the blink of an eye. And it's not just about you. We have to do this for every nurse who has spent the last 5 months working on the front lines, putting their health and lives at risk, for every essential worker who has made our made sure our shelves are stocked and there's food on the table for every grandparent and elderly neighbor who has been isolated at home, and for every Black, Indigenous, and Latinx folks who have been disproportionately impacted by this deadly virus. It's on all of us together to take care of one another, to look out for our neighbors, and to take responsibilities for our role in stopping the spread. So, Wisconsinites, please stay home as much as you're able. Take precautions whenever you go out, whether at work, at the grocery store, or hiking at a state park. And that means wearing a mask whenever you go out in public. Physically distancing yourself from anyone outside of your immediate household. That means maintaining 6 feet of distance from others wherever you go. Wash your hands frequently for 20 seconds with soap and water, and keep hand sanitizer nearby. And if you've been out and about with groups of people, get tested. Wisconsin now has 80 labs with a capacity of more than 19,000 tests daily. So if you have any symptoms or think you may have been exposed, call your healthcare provider or find a community testing site near you on the DHS website. Testing is the key to isolating those who may have been exposed, reducing the spread, and boxing in this virus. But please remember that a negative test today does not mean a negative test tomorrow. COVID-19 is still very present and spreading in our communities. Don't risk it. I want to thank all of you for the steps you have been taking to stay safe, the plans you have canceled, and the many sacrifices you have made. Those actions have surely saved lives. I know that if we continue to work together to box in this virus, take care of one another, and put health and safety of our communities first, we can and will bounce back together. Now I'll hand it over to Secretary-designee Andrea Palm for her COVID-19 update. Andrea?
Thanks, Governor. Good afternoon, and thank you all for joining us again today. I hope that you had a safe and relaxing holiday weekend. I know that these are challenging times for everyone, and that it can be especially difficult to stay home when we want to enjoy all that Wisconsin summer has to offer. However, we are currently experiencing a surge in positive COVID-19 cases throughout the state, and we must take necessary precautions to protect ourselves and our friends and our neighbors. COVID-19 is still pervasive in our communities. Since Memorial Day weekend, Wisconsin has added 16,972 more cases. For comparison, it took Wisconsin 5 months to get to approximately 15,500 cases. But in just a little over 1 month, that number has more than doubled. During this time, the percentage of cases coming from individuals in their 20s has also increased. Today, 24% of total cases are Wisconsinites in their 20s. While it is true that older adults may experience COVID-19 more severely, young adults are still at risk to fall very ill from the virus and are also likely to spread the virus in their communities just like anyone else. In terms of how COVID-19 is currently being spread, our contact tracing data reveals that 20% of cases in June reported attending a mass gathering. These events can include going to a bar or a restaurant or attending a barbecue. While there are ways that you can make gatherings safer for yourselves and others, so long as COVID-19 is circulating, gatherings are not entirely safe. Yes, wearing a mask or a cloth face covering, practicing good hand hygiene, and maintaining physical distance can help, but these actions do not eliminate the risk. I strongly urge folks to continue limiting your interactions to those you live with. It is the safest way to prevent COVID-19 infection and help stop the spread. So here are where things stand today. As the governor mentioned, we do have 80 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 19,014 tests. We've had 601,012 negative tests here in Wisconsin, an increase of 12,099. There are now 32,556 confirmed cases of COVID-19, which is an increase of 495 over yesterday. Our total deaths here in Wisconsin have now reached 805. The numbers we've shared lately are high, and I know it can feel unsettling to hear that we are in the midst of a surge. However, this data also reminds us that staying at home worked. We flattened the curve, and we're slowing the spread, and we can do it again as we continue to work together to overcome this pandemic. Local and tribal health partners continue to work diligently to ensure we are prepared for future surges. As they do this important work, please remember that our statewide response can only succeed when we do our part too. Stay home and practice good public health measures. Thank you for being committed to protecting the health and the safety of our state.
And thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please only one question per reporter. We'll begin with Sarah Thompson from WBAY in Green Bay. Sarah?
Good afternoon. Governor, I think this question would be for you. Is there any possibility of a statewide mask mandate being issued, and if not, why?
Well, as you may remember, the Supreme Court ended not only safer at home, but really constricted what created a chaotic situation, so we really don't know if I have the authority to do that. From my vantage point, a health emergency declaration, even though right now the Republicans could actually come into session and continue the one that we had. But in turn, we're looking at it, but frankly, the Supreme Court has made it very much more complex than what it ever should have been. Obviously, and I just talked about this, the importance of masking is really critical to slow things down going forward, and has always been one of the main ways that we keep safe. So clearly it's an important topic, but because of the complexity of and frankly the Republicans' really interest in everything I do around this topic, taking me to the Supreme Court where they know that they'll get a win. It makes it unlikely, but it's something that we are considering.
Thank you, Sarah. Now to Victor Huckabo from CBS 58 in Milwaukee. Victor?
Hi, good afternoon. Thank you again for taking the call. I guess my question's for the governor. Education Secretary Betsy DeVos says she was on a phone call with governors and said that she expects and wants schools to be fully operational in the fall. And she said anything less would fail students and taxpayers. Of course, DPI has submitted its own recommendations for districts, and districts will ultimately make their own decisions. My question is, were you on that call, and also do you agree with Secretary DeVos's assessment that not having schools open full time for in-person instruction is a failure to students and taxpayers? Thank you very much.
Yeah, great question. Not only was I on that call, but I spoke to the group right after Secretary DeVos. And while I didn't challenge her premise, I did talk about the document that the Department of Public Instruction and others, including our Department of Health Services, put together to provide guidance for local school districts. Local school districts will make the best decision possible for them. And I know some districts are thinking about the possibility of doing some virtual and some in person at the same time. Do I think in person is preferable? Absolutely. I've always felt that way. But I always encourage school districts when they ask about this is have all the options on the table so that they're not surprised. It's important for school districts and parents and kids to be prepared. But at the end of the day, I would not consider a district who offers a hybrid where it's partially in school, partially online, to be failing in their responsibilities. they have to make that decision locally. I don't think that's something that Secretary DeVos can discern necessarily from Washington, D.C.
Thank you, Victor. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. I was wondering, there was around $110 million that went to nursing homes, rural health clinics, and others. I think the funding, the application period closed last week on that, and there's going to be an additional funding period. Can you elaborate on how many people applied for that funding and how much is left for the additional application period? Thank you.
Yeah, Sean, we actually extended the deadline for that program right about the same time we announced that offering. The feds also announced some funding for a similar set of providers that are eligible for this funding. And so as folks are applying for ours, working through what they're getting from the federal payment, based on some conversations with stakeholders and some feedback, we extended that deadline so that folks are able to really maximize their ability to show their expenses and losses. So we added, or we extended the period of time by which you can record those expenses and losses and that be part of your application. Again, recognizing that the funding from the federal government was going to alter the applications for some of these providers. So we want to make sure to get that money out to folks. We have, for folks who have submitted applications and are qualified, we have started pushing money out the door, but did want to give all of the providers who are eligible a fair crack at getting some money through this $110 million, and so therefore did extend the deadline. We can certainly give you more specifics, Sean. I don't have the total numbers of applications that have been received thus far on the top of my head, but our team can certainly follow up.
Thank you, Sean. Now to Scott Bauer from Associated Press. Scott?
Hi, thanks again for taking the call. Governor, I want to get your reaction to the guidelines that came out yesterday from ICE about saying that international students have to be taking classes in person at higher ed colleges, universities, or else they'd have to go home. I'm wondering if you agree with that policy and what effect you think they may have on UW-Madison.
Well, I think it'll have an impact on those young people primarily because there will be times, and I know UW-Madison, as I think you're alluding to, is planning some courses that happening virtually. You know, I get the interest in making sure that people have a face-to-face opportunity to interact with teachers, professors, or whatever, but there may be situations where it just can't happen because of a surge or because of several issues making things more complex. So to suggest that they won't have the opportunity to participate in education just because they're not there physically 100% of the time, I think that's a huge mistake.
Thank you, Scott. Now to Courtney Garish from Spectrum News 1. Courtney?
Good afternoon. Had a question coming off the holiday weekend and some of the long lines the community testing centers had yesterday. When do you expect to see those testing results reflected in the overall numbers? And then also looking at the surge that we're seeing in positive cases, but with the plateau in hospitalizations that we've seen since June, and then also as of yesterday, no deaths reported for the last 3 days. How do you balance those positive cases with the other two factors?
Mm-hmm. Yeah, and I'll let Dr. Westergaard weigh in here as well. I think so. We are running tests efficiently in terms of the throughput, the lines that we have been seeing. I think we don't anticipate an increase in the what we tell folks when they pull up to the community testing sites is expect results in 3 to 5 days. We have been resulting and turning tests around in in the majority of cases in less than 2 days. But obviously, it is important to us to maintain quick turnaround on testing because it is that link from there to contact tracing to understanding who that person has been in contact with to stop the spread. Right? It is an important link in the chain to really combat this virus, and so we continue to want to make sure our testing times remain. The turnaround times remain as low as possible, and we'll continue to focus on that and work on that. I think so. Generally speaking, I think folks should directly to your question should expect results within 3 to 5 days. But I would say if someone does not receive their test result timely, they should reach out. Just because there are instances where the person, when they registered before they got to this actual swabbing part of the test, maybe they transposed their cell phone number or their email address, or maybe the person at the testing location entered something incorrectly. So we certainly have anecdotal one-off instances where somebody in the chain of that testing didn't get it exactly right, and we want to know about that because that person needs to get their result, and so we'll chase it down certainly. But as a general rule, systematically, we are seeing good turnaround times and people receiving results in a timely fashion. As it relates to deaths, obviously we were all very pleased to see 3 days in a row without deaths. It is what we would like to see on a very consistent basis. It's why we all together worked so hard to do what was necessary to reduce the spread and flatten the curve. And as we are starting to see this surge, I think we want to encourage folks to work again with us to reflatten the curve, to stop the spread, to slow the incline of the growth in cases that we are seeing. And I think I'll let Dr. Westergaard talk a little bit about the interplay with the younger caseload and how that might impact.
Yeah, thanks. It's one of the really distinctive things about this virus and this epidemic is the broad range of illness. So the risk of severe illness and mortality is a very wide range. So children don't get very sick at all. In fact, many times it's unusual for them to have any symptoms, whereas people in their 60s, 70s, 80s are expected to have severe illness and hospitalization in a death rate of greater than 10%. So that's uncommon for a respiratory virus to have such a wide range. And so I think one of the difference that we're seeing now are the number of deaths we're seeing is lower because the proportion of people who are becoming infected in that younger age group is higher. So that's really it's a mixed blessing. It's obviously it's a very good thing that younger people aren't expected to get very sick. But because a lot of people are becoming infected in a younger age group, that also means that the number of people with asymptomatic infection is increased, and that's the risk factor that the epidemic can spread silently in communities, which makes us even more important to really lean in and get testing with a low threshold and in a lot of different settings, the community testing sites and the healthcare settings.
Thank you, Courtney. Now to Will Cushman from WisconSine. Will?
Good afternoon. I was also curious in the rise in cases lately with without a rise in deaths or hospitalizations. I'm wondering if Dr. Westergaard, if you could go further with your interpretation, would you expect to see either hospitalizations or deaths rise in coming weeks as cases kind of mature, so to speak?
Yeah. Thanks for the question. I wouldn't say we expect to, but I think it presents a dangerous situation when the epidemic overall is growing, particularly in transmission being driven by people with minimal infections. What's really so very serious about the situation we're in right now is that by transmission going in the wrong direction, we're at risk of the virus getting a foothold, so to the point where it's widespread. And in that situation, everybody's at risk. So unless we really positively stop that, if we really try to find chains of infection that are occurring in asymptomatic people and stop them through isolation and quarantine, the danger is that these transmission networks are going to continue until they get to older folks, people who are vulnerable, and that is what could translate into a large surge in severe illness and deaths. So I wouldn't say we expect to see deaths go up, but it's a really dangerous situation right now that transmission seems to be going up, and it really requires us to act resolutely to try to break those chains.
Thank you, Will. Now to Brianna Riley from the Cap Times. Brianna?
Thank you so much for holding this call. This question is for Secretary Paul. What information was DHS planning to list on its website this week relating to businesses that had positive COVID-19 cases? For example, would that have included names of businesses, the number of employees with positive COVID-19 results, dates that the individual had contracted it, and whether they had recovered, or what exactly was going to be included in that?
Thanks, Brianna. So we are working through a number of open records requests related to outbreaks in businesses, and certainly had been discussing with our partners around the state how we might, whether we should and how we might provide that information on our website. Through those conversations, we decided that we would certainly would not be doing that this week, and so we think that it's important that obviously we continue to work through these open records requests and do what we need to do from that perspective, and we'll just continue to talk with our partners about the way to move forward on this issue.
Thank you, Brianna. Now to Abigail Henke from NBC 26 in Green Bay. Abigail?
Hi, thanks for taking my question. It's kind of similar to ones that have just been asked, but looking at the numbers of the recovery rates, I believe cases have been about 80% recovered in Wisconsin. So how do we kind of compare that to the active cases we're seeing right now?
The biggest driver of that recovered number is really time. So we don't routinely close the loop and have public health confirm symptom resolution with everyone. So that statistic, while really important, we need to understand that most people recover, isn't driven so much by actual clinical follow-up, but by does enough time go by after a case to presume that they've gotten better, and to ensure that people haven't been hospitalized or passed away. So I think the number of recoveries right now is high and will remain high. And again, we expect the large majority of people to fully recover with this infection.
Thank you, Abigail. Now to Brett Lemoyne from Fox 6 in Milwaukee. Brett?
Hi, thank you for taking our call. My question to you, Governor, is if the number of cases have increased to the point where in the span of 1 month we're now equal to the first 5 months of the pandemic, if you did have the power to issue another lockdown, would you do it today?
Well, that's a hypothetical, but I believe that we would not have to reinstate safer at home, but look at other ways to corral the pandemic, and masks are one of those.
Thank you, Brett. Now to Stephanie Hoff from West Politics. Stephanie?
Hi, and thank you for taking my call. My question is similar to the one before, and it's for Governor Evers. If the Supreme Court ruling didn't shut down safer at home, what would Wisconsin look like right now?
Well, we were in a good place with our efforts around safer at home, and I think what we did, in fact, I'm convinced what we did, saved lives and helped us mitigate several people's actually having the virus. And so I would believe that we would have kept it up until whatever date it was in May, that we would have saved more lives and that we would have prevented more people from having a positive test for COVID-19.
Thank you, Stephanie. Now to Rachel Glass from TMJ4 in Milwaukee. Rachel?
Hi there. Just wondering where the state is at in hiring contact tracers, and then how many of the 32,000 cases have had someone contact them. Thank you.
So we are at just about 400 contact tracers from the state perspective, and actually we'll be bringing on an additional 40 this week and get them in through training and out in the field. As we've seen surges around the state, we have at the state been very active in helping local public health fill the gaps. At their request, if they've got a bunch of cases that come through that they need our help, they give us a call, and we dedicate some resources to helping them make the contacts that they need to make to stay up with their new positive cases. And we will continue to provide that service and that wraparound and partnership with local public health as they do this work on the ground. And want to make sure, to your point, that in addition to having good turnaround times on our testing results, that we are reaching folks that test positive and understand their contacts so that those can be turned around and contacted quickly as well. Again, all in an effort to help local public health stop the spread in communities all around the state.
Thank you, Rachel. Now to Nick Bauer from WISN TV in Milwaukee. Nick? WISN? Okay, let's move on then to Mark Lee.
My question is for the governor. Thank you. Governor, you've said that your hands are tied by the Supreme Court ruling as for any statewide orders. Is there a level at which the spread of COVID cases, if it continued to rise, that it might constitute a separate emergency, that you could issue a new order and still survive a Supreme Court challenge for a while?
That would be perfect. But we're looking at all options that are available to us. I'll just relay this. It's a small n, meaning one, but I had an interesting call from a business leader just the other day. Please mandate the masks. Our ability to survive economically as a state is counting on this virus being handled appropriately, and he asked me to do it, and I talked to him about the possibilities of it being challenged in court by the Republicans, which is probably 100%, and our chances of losing in the Supreme Court probably very close to 100%. And he said, do it anyway.
Okay, thank you, Nick. Now to Mark Leland from WLUK TV in Green Bay. Mark?
Thank you. I know you've cautioned against public gatherings. With that in mind, a lot of counties have canceled their county fairs. Some have planned to go on, have held them. I'm wondering what impact, if any, have you seen from the counties that have held these fairs? And what is your thoughts about counties deciding to hold fairs? Should they go on? Or what would you recommend if they are planning to hold a county fair coming up?
So at the local level, obviously, when someone tests positive, it would come up in the course of the interview of the questions about where they had been and what the possible locations and contacts they had that might have resulted in them becoming infected. And so whether it's a mass gathering that's a county fair or a barbecue or a house party or any other sort of mass gathering where you certainly can see transmission, we are cautioning against risking that kind of interaction because we know how contagious this virus is. And I think it's part of why you are starting to hear and starting to see more local jurisdictions encourage mask wearing. It's why we as a state are encouraging folks to wear masks. We want to mitigate risk as much as possible so that we can stop the spread and really beat this virus, and until we get a vaccine that can help us more medically. All we've got is each other. So I think our general guidance around large gatherings is that they are risky. That if you are going to do them, you should do the things we've talked about since the very beginning, which are the good hygiene practices: wash your hands, wear a face mask, social distance, and do the kinds of things that are necessary to mitigate the risk as much as possible, recognizing that a large gathering inherently is a risky thing to do from a transmission perspective.
Thank you, Mark. Now to Jeremy Janine from Urban Milwaukee. Jeremy?
With regard to the serious spikes we're seeing in Florida and Arizona, how is Wisconsin faring compared to those states?
I'll let Dr. Westergaard comment on that, but I would say it's one of the things about this pandemic more broadly is we've been lucky in Wisconsin in that in both March and April, and now here in June and July, we aren't on the leading edge, right? We've had the opportunity. We did in the early part of when it came to the United States. We were able to see Seattle and Washington and New York and what they were dealing with, and we're able to take those lessons and help us together as a state flatten the curve and mitigate the spread. And I think we should be doing that again now. I certainly I'm sorry that there are any parts of this country that are seeing the kind of increases in cases that they are, but it is an opportunity for us to heed the caution and do the things that we can and know to do together to not get to the place where we are seeing an incline in our infections to the point where our hospitals cannot sustain the level of care that is needed for folks who are coming through the doors. But I will let Dr. Westergaard speak specifically to the comparison.
Yeah, thanks. I think this simplest way to describe it is that our trends are in the same direction. The size and the shape of our curves look different. So it's a question of magnitude. Cases are going up in Wisconsin. They are going up. We've had 500 to 600 new cases a day this week. Arizona and Florida have been having many thousands per day. So it's a different situation in terms of the magnitude. But we're going similarly in the wrong direction, meaning there's more cases this week by far than there were the week before and the week before that. The other thing that's very concerning is that it seems like the reasons that the numbers are going up seem to be similar, meaning the same risk factors of gathering indoors, particularly social gatherings in bars and restaurants, seem to be the same forces seem to be at work. So I would say the stage is set for the same types of things happening in other areas of the country to continue to happen in Wisconsin unless we do things to turn this around. But the numbers don't look as grave as they do in some of the southern states.
Thank you, Jeremy. Now to Steve Westergaard from the Platteville Journal. Steve? And a reminder, *6 to unmute your phone. Steve Westergaard from the Platteville Journal. And we'll move on then to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you all very much for the call today. Just curious, Governor, you had mentioned that you're exploring all available options in response to the pandemic. Can you give any additional details on what that might entail? Or when we looked at what happened here today in Dane County, is it more likely that we're going to be seeing potentially more kind of those local orders like the mask one we had here? And then just kind of lastly along those lines, do you guys support those kind of local orders? Thank you.
Sure. Yeah, and I just have... I'll probably go off topic here a second, but yes, if indeed we continue to be hamstrung by a chaotic decision by the Supreme Court, we support local health officers making that decision based on the science and what is happening on the ground. That said, I also have to just give people another request, and that is local health officers are doing their damnedest to do the right thing. And hearing stories of them being harassed personally, professionally, it saddens me, because whether it's the issue of wearing a mask or issue of a decision that's made locally by a public health officer based on science and based on the best recommendations, to politicize that to the point where people are harassed locally because of that, we're better than that. And I'm glad it's not happening everywhere, but there's enough of that out there that I encourage people to understand that this is not a political issue. It's a virus issue. The virus doesn't give a crap about whether you're a Democrat or Republican. And people at the local level are just trying to do the best they can.
Thank you, Mitchell. Now to Laurel White from Wisconsin Public Radio. Laurel?
Yes. Yeah, thank you so much for doing this and taking my question. The governor spoke earlier about sending PPE to schools and businesses across Wisconsin. I'm wondering if there are conversations about getting PPE to child care providers, and if so, what the timeline on that might be.
Yeah, and we are looking at that, and some of the CARES money that we have provided also was for that purpose, not only to make them whole, but to get them ready for having little kids in their businesses. So we look forward to helping them out. Is there anything more specific than that? No. Thanks.
Thank you, Laurel. Now to Denise Lockwood from Racine County Eye. Denise?
Thank you. I had a question. Can you hear me?
Sure.
Okay, good. I just wanted to find out, are you guys seeing a difference in the number of people actually showing up for testing? Specifically in Racine County, I've heard from a number of public health officials here that are saying the testing sites, they just aren't seeing the number of people showing up, and that contact tracers have been hung up on and cursed at. And what are the steps that the state may be taking on to kind of address the politicization of the COVID-19 virus?
It's a great question, and Dr. Westergaard may have more details, but I would say more broadly, sort of echoing the governor's sentiments, the virus here is the bad guy, and it has been incredibly stressful and produced a lot of anxiety for all of us as we have worked to deal with this together, right? And this is like nothing anybody has ever experienced. And so, tensions are running high, emotions are running high, and I would just encourage folks, if they need help, we certainly have built up a number of resources on the DHS website to help folks cope with the anxiety and the stress that they are feeling, because I think we should be working hard together, not to take it out on each other, but to understand and to recognize that differences of opinion are not fundamental to the way we need to deal with this virus. The science and the facts are what they are, and we should all be demonizing the virus, not each other, and really working together to defeat it. It is the way we will get through this. It is really our only option, and I think generally speaking, taking down the temperature on the conversations that we're having with each other about combating this virus will go a long way to helping us work together. I think as it relates to contact tracing specifically, it does continue to be important for folks to answer their phones. We want to make sure that people understand that there are scammers. This is an atmosphere in which scammers like to try to take advantage of people. So if you get a call from a contact tracer, we really do encourage you, we strongly encourage you to talk to them, to pick up the phone. but please, no contact tracer will ever ask for information like your social security number, your bank account, a donation, your credit card, anything that smacks of your personal identity. The red flags should go up. But otherwise, we really encourage you to be a partner with that contact tracer, with your local public health department, so that we can help break these chains of transmission and reduce the spread. I don't know if you have more details specifically about Racine.
Yeah, I checked on our website. We don't have the week-by-week county-level data to be able to say that trend, whether Racine County is having fewer tests overall than they did a week ago. In general, Racine County is one of our counties that has done a relatively high number of tests, so they've done quite a bit. So we can't speak to any trend, but I guess just to emphasize for the third time, our relationship with local public health is so important. When we try to work as a team in all aspects of this, and we've heard similar things that are really discouraging about health officers and local public health nurses being treated poorly, which is really bothersome. I personally hold public health nurses in probably the highest regard. I was raised by a nurse. They have them in my family, and certainly chose to come and work in public health when had a lot of other options. So I think this is such important work, and the people who do this in local communities really ought to be praised. And we also know from experience that it takes one mean word to really ruin someone's day or someone's week. So counterbalancing that with kindness and praise to the people that work in public health locally could really go a long way. So I encourage all of us to just hold up local public health officials and people who work in that field in the highest regard, because they are working so hard.
Thank you, Denise. Now to Emily Fannin from WKOW-TV. Emily?
Hi, this is Danny in for Emily, and I apologize if this was already answered, but I got on the call late. In regards to the PPE going out to schools, restaurants, grocery stores, food processors, is there an application process for this, or is this going out to all schools? How does this process work if any businesses or schools wanted this PPE?
I'll just talk about the schools. That is being done through the Department of Public Instruction. They're connecting with schools across the state, and so that is pretty much set by them and by their contacts. With the other world, I think I'll let Secretary Palm talk about that.
Our PPE distribution throughout this response has been done through our partners in emergency management and local emergency managers in connection with the recipients on the ground, and we have done it through surveys where people indicate they collate at the local level the requests that they have received, the needs on the ground, and then they push that up into the statewide response into our partners at the SEOC and emergency management, and then they're based on all the requests we get from around the state, it's allocated that way, and that has been done on a regular basis since the beginning. And so whether it was PPE that we received through FEMA or that we procured or that was donated, or these cloth masks in the example today that the governor announced, we have used our infrastructure through emergency management to be the eyes and ears on the ground in local communities to take requests and filter them up through the system to the SEOC for distribution out of our warehouse.
Thank you, Danny. Now to Adam Rogan from the Journal-Times in Racine. Adam?
My question has been asked, so I should be all set. Thank you.
Thank you, Adam. Now to Eric Gunn from Wisconsin Examiner. Eric.
Thanks for taking my question. So 2 months ago, 43 lawmakers signed a letter urging the Wisconsin congressional delegation not to support federal aid to the states. It has now turned out that at least 3 of those members of the legislature got PPP through businesses they own, and others have family members employed at firms that got PPP. A question for Governor Evers: do you want to see Congress pass legislation that would provide direct aid to the states to replace revenues lost due to COVID-19? And how does it strike you to see some lawmakers opposing that kind of aid while accepting PPP for their businesses and organizations? Thank you.
Yeah, great question. And yes, I do support Congress taking that role. Clearly, revenue shortage is a major issue for us here in our state, but also every state in the union. And it directly impacts not only the economy of the state, which it clearly does, but it impacts the amount of resources that local governments rely on the state. So I do support that. Now, I didn't know that there's allegations that some legislators are involved with organizations or companies or businesses that have PPE, so I'm not able to respond to that.
Thank you, Eric. Now to Maddie Heim from USA Today Network, Wisconsin. Maddie?
Hi, thanks so much for taking this call. I have another question about contact tracing. I'm just wondering, is the state tracking the outcomes of how well that's working, like how many contacts are reached successfully, or is that information left for the counties to manage about, how successful the practice is?
So we, in partnership with local public health, are working on establishing a framework by which we're tracking this kind of information. We're able to discern the number of contacts per positive case and sort of how that cascades down to the contact tracing level and stopping the spread. Those conversations are very actively engaged right now with local public health. What are the right measures? What really gets at those questions? How do we know what's the right threshold? How do we know what success looks like, et cetera? So we are very earnestly working through those issues right now with our local public health partners. But they all at the local level are tracking those kinds of issues, again, primarily so that they understand that they're getting to their cases in a timely manner, so that if they need our assistance, if they need our contact tracing capacity, that they are tracking that in a way that they know when to pick up the phone and tell us that they need to enlist our help with X number of cases because they need to make sure they get to them in a timely way.
Thank you, Maddie. Now to Will Keneally from PBS Wisconsin. Will?
Hi, thank you for taking my call. And I had a couple questions answered. So I just wanted to briefly ask you, Governor, if you had any reaction to the 50 miles more protesters that showed up at the governor's mansion over the weekend?
Sure. From what I observed, the group was respectful. They were concerned about the right things, and from my observations, there was little or no problems with them. At some point in time, I hope to have a chance to chat with them. I know they are concerned, as I am, about issues of racial injustice in the state and this country, and looking forward to working with them or any other group that wants to move things forward.
Thank you, Will. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly.
Hi, thanks for taking this call. Governor, if schools open in the fall, if and when they open in the fall, and an outbreak or outbreaks are tied to schools, would you close schools again?
Well, I certainly would. We would take time and effort to make sure that we're in close communications, not just with the county public health officials, but also school officials to see how it's working out for them and whether they need to take a pause or not. I think, to be honest with you, that hopefully if we're in a position where the virus is being managed in the state of Wisconsin, and that we would more likely see individual schools or maybe a classroom taking 14 days to self-isolate at home rather than a statewide shut down.
Thank you, Molly. Now, our final question this afternoon belongs to Amy Flugsapt from WMTV NBC 15. Amy? Reminder, *6 to unmute your phone. Amy Flugsapt? We'll move on then and go back one more time to Steve Westergaard from the Platteville Journal. Steve?
Thanks for taking my question a second time. Operator error on my end. So earlier in this press conference, Governor, you said that you didn't feel as though the federal Secretary of Education should be mandating how schools operate in the midst of the coronavirus here in Wisconsin. Of course, the state closed all of the schools in the state in mid-March for the rest of the year and didn't give anybody an individual opportunity to make their own decision. So are you pledging then or not that you will not close schools in the fall in case there's another upward blip in cases?
Well, I just have to clarify something. When I was responding to the question about Secretary DeVos, it was her statement that she said if you're not in person, you're not getting an education. And I disagree with that. There are school districts that are likely to do some things that are online at the same time that they're doing things in person, trying to meet the needs of kids and parents. So I just don't think that's I understand she has a right to say what she wants to say, and she wasn't mandating it, so I guess I'm just differing in her opinion. As I just stated, I believe if we are in a good position as it relates to managing the virus and boxing it in, if there is going to be any Plan B, Plan C for local school districts, it will likely be made, that decision be made there, and it could be an individual school, it could be an individual classroom. But at the end of the day, we have to spend our time right now determining how best to convince the people of Wisconsin to take seriously, and many people are, so I'm not casting aspersions on everybody in Wisconsin, but we just have to continue to be careful and wear a mask and stay physically distant and making sure you're having good hygiene and avoiding places that have a whole bunch of people in a small area.
Thank you, Steve. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, and the Department of Children and Families, as well as Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.